An investigation is underway after a fatal shooting south of Nampa. Earlier today, Canyon County Sheriff deputies responded to gunshots at a home in the Beaumont community. Officers found a man who died inside the house. First responders took another victim to a nearby hospital with non-life-threatening injuries. The sheriff's office says the alleged shooter was detained at the house and is cooperating with investigators. Idaho faces another class action lawsuit over cuts to Medicaid. This time, people are trying to halt cuts to services provided to patients with severe mental illnesses. Our Derica Case spoke with Access Behavioral Health Services in Boise, one of the 5 health agencies that filed a lawsuit. Derica.
Access Behavioral Health Services is voicing their concerns about several key programs being discontinued starting this month. The Idaho Sheriff's Association also penned an open letter to Governor Little regarding public safety.
That's the ultimate worry that we all have is how many of our clients will end up passing away because they could not take care of themselves medically.
Laura Scurry, co-owner of Access Behavioral Health Services, says the impact of Idaho's recent Medicaid cuts on mental health services is more than just the 3% holdback that Governor Little implemented.
The Department of Health and Welfare took that and turned it into a 4% cut for most services. As a result of that 4% holdback for providers to bear, the state determined that they weren't able to hit the required holdback from the governor's office, and so they started doing service cuts.
The Department of Health and Welfare announced service cuts to 5 programs, including ACT Peer, a service for people with very complex mental health issues.
And now I have 12 peers that do not have jobs that will go back on to state services and who have spent hundreds and hundreds of dollars getting their certifications, then they're now useless.
Scurry says Access Behavioral Health has more than 50 clients with severe and persistent mental illnesses that use ACT Peer as a resource.
The individuals receiving that service maintain a certain level of stability, and ACT is shown to decrease critical incidences with community members. We believe that within 30 days, those critical incidences will start back up again.
One reason Medicaid cuts are happening is because the state of Idaho has a projected budget shortfall, meaning they expect to run out of money or have less money than planned. So scaling back Medicaid is supposed to reduce cost. However, the Idaho Sheriff's Association says the burden will fall back on county government.
We're going to end up going to the emergency rooms with those folks, which overburdens the medical side of the system.
Bonneville County Sheriff Sam Hulse, who is the president of the Sheriff's Association, also wrote an open letter to Governor Little, voicing their concerns about the several key programs that were discontinued.
What we're trying to do right now is to ask the state to reconsider these cuts, to look at things like the rainy day fund, for example, and make these systems whole again so that we don't have to suffer this, that we can realize, hey, let's fix it now before we create a catastrophe.
Access Behavioral Health also mentioned that it took tens of millions of dollars to set up the programs they have available to those with mental health issues, and taking away those resources can increase community safety risk as well. KTVB also reached out to the Department of Health and Welfare, but they declined to comment.
Derica, thank you.